A very big hello to all my dear students. Welcome to the T2O series in your favorite channel, You and I with Dr. Ruchi Rai. So, how are you all doing? Today we are going to discuss which alphabet? It is K. Yes, I think this is an easy guess. Very important topic. We will be talking about keratoconus. What are the points? The discussion has to be crisp. Therefore, it will be all question oriented. Okay. So when you say keratoconus, you know it's a conical protrusion of the cornea. And whenever the cornea is protruded like this, it is making the, so it is not like the whole protrusion. Had it been the whole protrusion, this is keratoglobus, then the only problem would have been myopia. But what is happening? This protrusion is happening in an even area, and therefore this is causing irregularity in the cornea, leading to not only myopia but irregular astigmatism. This is the main problem in keratoconus, due to which this patient is going to complain of diminution of vision. Right? So we will not forget the word irregular astigmatism. Okay. Of course, we know this is mainly a genetic disease and it can be progressive. Sometimes it is non-progressive or sometimes it can be progressive or non-progressive. Okay. So patient is complaining to you of diminution of vision, and when you examine this patient, what are the signs? Very, very important. Number one, this is exam question, deposition of iron on the which layer? At the base of the cone. This is at the epithelial layer, right? So this is what is we have learned as Fleischer's ring. It's already written here. This is Fleischer's ring, which is iron deposition on epithelium. Okay. Iron depositions, which are surface depositions, please keep in mind they're always on the epithelium. So this is asked. It is at the base of the cone, right? If you are going to do a retinoscopy, what do you get? Another question, I'm just mentioning it here. We can get scissors reflex, where the two light reflexes, they look like blade of scissor. We will not forget the scissors reflex on what? On retinoscopy. Okay? Okay, what next thing we have to learn and ask in the exam? It is V-shaped deformity of the lower lid on looking down. What are you looking here? This is what is Munson sign, right? So Munson sign is another exam question. Next feature, of course, when you're doing a corneal topography, you get irregular astigmatism, isn't it? Yes. And next we talk about is this. This is oil droplet reflex. Oil droplet, right? Oil droplet cataract, galactosemia. Oil droplet reflex. We are talking about keratoconus. How do you see this reflex? Please don't forget, this is our distant direct ophthalmoscopy. It is distant direct ophthalmoscopy. ठीक है? चलो इसके बाद next क्या पढ़ेंगे? And any other oil that you know? Oil globule reflex, which is seen in anterior lenticonus. Yes. Then another finding, as you can see here, these are break in the descemet membrane which are vertical. This is what is called Voges stria. Okay, due to excessive stretching. So remember, half stria is seen in congenital glaucoma. It is horizontal or circular, but this one is vertical, is Voges stria, V for V. Right? Then we talk about next is, what is this? This is also exam question, prominent corneal nerves. And why are the nerves prominent? What we will say, this is because of thinning of the cornea due to protrusion. Right. So these were the quick on examination findings that they ask you in your keratoconus. Then of course, what about the treatment and how you manage? Initially you may give specs, but specs cannot treat in irregular astigmatism. So what is the first thing after this is becomes your contact lens. Specs, so very quickly they become ineffective. We have to go to the contact lens. Which contact lens? So what is the choice of contact lens? It is rigid gas permeable lenses, because they are going to make this irregular surface will be replaced by a regular surface. So RGP lenses are semi-soft contact lenses. They are going to help. Okay. So we will remember this as the choice of contact lens. That is what they ask. This is not working. And if it is progressive, you can go for C3R treatment. C3R is corneal collagen cross-linking with riboflavin. So you give riboflavin eye drops, and after giving this, we are actually exposing the eye to ultraviolet A rays, right? So the binding is happening. Collagen binding will prevent any progression of the conical protrusion, right? Yeah. And if this is also not working, our final resort always is replace the cornea that is penetrating keratoplasty. Right? So let's remember all this. If they ask you the treatment of choice, we can answer here C3R. Treatment of or contact lens of choice, then we answer contact lens of choice is RGP. So many questions from this topic. Please learn it nicely. Okay. Let's solve a question here. In keratoconus, myopia is it index, axial, curvature? Of course, we know it is mainly curvature, right? Yeah. So that was all. Thank you so much. Stay blessed and keep smiling.